1. A 65-year-old male presents with crushing chest pain and diaphoresis. Vital signs: BP 90-60, HR 110. What is the most appropriate first intervention? A. Administer nitroglycerin. B. Place in semi-Fowler's position. C. Start 4 and give fluid bolus. D. Apply high-flow oxygen. 2. What is the Glasgow Coma Scale GCS score for a patient who opens eyes to pain, uses inappropriate words, and withdraws to pain? A. 8. B. 9. C. 10. D. 11. 3. Which of the following findings is most indicative of a tension pneumothorax? A. Bilateral crackles. B. Tracheal deviation. C. Bradycardia. D. Productive cough. 4. A patient with altered mental status has fruity-smelling breath in deep, rapid respirations. What is the most likely cause? A. Stroke. B. DKA. C. Hypoglycemia. D. Asthma. 5. When assessing a trauma patient with suspected spinal injury, what is the priority after ensuring scene safety? A. Insert OPA. B. Apply spinal motion restriction. C. Control external bleeding. D. Check pupil reactivity. 6. Which airway adjunct is contraindicated in a conscious patient with an intact gag reflex? A. Nasopharyngeal airway. B. Oropharyngeal airway. C. Supraglottic airway. D. Bag valve mask ventilation. 7. A patient is in respiratory arrest with a pulse. What is the correct ventilation rate using a BVM? A. 12 to 20 breaths per minute. B. 1 breath every 5 to 6 seconds. C. 30 compressions to 2 breaths. D. 6 breaths per minute. 8. Which rhythm is most appropriate for defibrillation? A. Asystole. B. P. C. Ventricular fibrillation. D. Sinus tachycardia. 9. What is the preferred fluid for initial management of hypovolemic shock? A. D5W. B. Normal saline. C. 0.45% NaCl. D. Ringer's lactate. 10. During CPR, when should pulse checks be performed? A. Every 30 seconds. B. After each breath. C. After 2 minutes or 5 cycles of compressions. D. Every 5 minutes. 11. A known epileptic has a seizure lasting over 5 minutes. What is the appropriate action? A. Administer oral glucose. B. Monitor only. C. Administer midazolam or diazepam. D. Restrain limbs. 12. Which of the following is a typical presentation of anaphylaxis? A. Hypertension and bradycardia. B. Wheezing and urticaria. C. Sneezing and nasal congestion. D. Productive cough and rales. 13. A diabetic patient is unresponsive, glucose reads 2.1 mol/L. What is the next best step? A. Administer glucagon IM. B. Administer insulin. C. Monitor and transport. D. Encourage oral intake. 14. What is the correct dose of epinephrine for an adult experiencing anaphylaxis? A. 0.15 mg IM. B. 1 mg 4. C. 0.3 to 0.5 milligrams IM. D. 2 milligrams 4. 15. Which of the following is characteristic of a stroke in the right hemisphere? A. Aphasia. B. Right-sided weakness. C. Left-sided neglect. D. Visual field loss on the right. 16. A 22-year-old male has a penetrating chest wound with bubbling from the site. What is the first intervention? A. Apply a bulky dressing. B. Seal with occlusive dressing. C. Start 4 fluids. D. Intubate. 17. Which sign is most specific to pericardial tamponade? A. Tracheal deviation. B. Hypotension. C. Muffled heart sounds. D. Rowels. 18. A trauma patient has a femoral fracture and hypotension. What type of shock is most likely? A. Cardiogenic. B. Hypovolemic. C. Obstructive. D. Distributive. 19. What is the preferred site for intraosseous access in adults? A. Tibial plateau. B. Iliac crest. C. Sternum. D. Proximal tibia. 20. A motorcyclist crashes and is unresponsive with a GCS of 5. What is the most critical first step? A. Insert OPA. B. Administer naloxone. C. Establish airway and ventilate. D. Start 4 and give fluids. 21. A woman in her 3rd trimester presents with painless vaginal bleeding. What is the most likely diagnosis? A. Placenta previa. B. Abruptio placentae. C. Uterine rupture. D. Threatened miscarriage. 22. Which is the correct compression to ventilation ratio for a newborn with a heart rate less than 60 bpm? A. 30:2. B. 15:2. C. 3:1. D. 5:1. 23. What is the APGAR score of a newborn with a pulse of 110, active movement, grimace, pink body with blue extremities, and irregular breathing? A. 5. B. 6. C. 7. D. 8. 24. Which sign is most concerning in a pediatric respiratory emergency? A. Nasal flaring. B. Stridor. C. Grunting. D. Silent chest. 25. An elderly patient on warfarin falls and hits their head. What is the most important next step? A. Monitor at home. B. Administer acetaminophen. C. Transport urgently for evaluation. D. Reassure and discharge. Canadian Organization of Paramedic Regulators examination. The Canadian Organization of Paramedic Regulators COPR examination test is a nationally recognized certification exam designed to assess the competency of entry-level paramedics across Canada. It serves as a standardized evaluation for candidates seeking provincial licensure at the Primary Care Paramedic PCP, Advanced Care Paramedic ACP, or Critical Care Paramedic CCP levels. The exam tests knowledge and skills in areas such as patient assessment, airway management, pharmacology, trauma care, medical emergencies, and professional ethics. Administered in both written and practical formats, the COPR exam ensures that paramedics meet consistent national standards of care and are equipped to deliver safe, effective, and professional emergency medical services in diverse settings. Here are the top 5 beneficial uses of the sample exam. 1. Ensures national standardization. The COPR examination establishes a consistent benchmark for paramedic competencies across Canada, ensuring uniformity in patient care regardless of province or territory. 2. Supports provincial licensure. Successfully passing the exam is a key requirement for paramedic registration in most Canadian provinces, validating readiness for independent clinical practice. 3. Promotes public safety. By rigorously testing clinical and ethical knowledge, the exam helps ensure that only qualified individuals deliver emergency medical care, enhancing public trust and safety. 4. Identifies strengths and gaps. The exam helps candidates recognize areas of clinical proficiency and those needing improvement, guiding continued learning and growth. 5. Boosts professional credibility. Passing the COPR exam signals a high level of competence, enhancing employment opportunities and professional standing within the paramedicine community.